Zimbabwe will join the SADC region on Wednesday for a virtual meeting of ministers of health to assess the MPOX outlook. This is a meeting that had already been decided during the SADC summit hosted by Zimbabwe last month. The meeting comes at a time when an outbreak in DRC and other countries has made the world come to a point of alert with fears it could spread. The SADC meeting of health ministers is expected to develop a coordinated regional response. Now, according to the SADC Secretariat, the ministers will deliberate on the situation in the region and Africa, as well as discuss how to strengthen public health surveillance. The meeting will also discuss how cross-border disease surveillance should be coordinated to improve the rate of detection, strengthen prevention, and limit the spread. And I'm joined by public health specialist Retlo Matorwa to discuss MPOX further. Good evening. What are your recommendations to ensure that Zimbabwe is not caught off guard?
Good evening. Thank you so much for that question. I think as a Harare Institute of Public Health, we've been on the forefront in terms of advocating that the government should invest more resources in terms of disease surveillance. This would also help us in terms of be able to detect early infections when it comes to MPOX, and also the fact that our regional neighbors have also been affected by MPOX. Zimbabwe must tap into health intelligence from those countries to inform how best as a country we can respond to MPOX. Another very important issue is that Zimbabwe must strengthen its capacity in terms of creating robust health promotion messages that also target individuals, that also target our communities, to make them aware of the nature of this disease, how it transmits, how do we prevent it, and also basically how do we manage it. As a country, we need also to enhance our testing capacity to be able to detect earlier this disease, and also to ensure that our surveillance systems are strengthened at national level.
Now, perhaps as a follow-up, as we speak, is the surveillance on the ground adequate to ensure the nation is safe?
Yeah, the Zimbabwean government has been really been very vigilant in terms of not only its response but its preparedness in terms of MPOX. The Minister of Health in particular is keeping the nation updated in terms of whether Zimbabwe has cases to do with MPOX, how many people have been affected. That kind of vigilance, that kind of monitoring is very strategic, and I think at the moment it's also enough in terms of our preparedness. And also we know that Zimbabwe through SADC initiatives is sharing a lot of health information with our neighbors, which is also helping us in terms of our preparedness. We are also on an emergency setup where we are also involving other partners to also help in terms of mitigating the effects of MPOX.
And lastly, do you think the public has enough information on MPOX?
It's very difficult to say for certain whether the public has enough information. It's never enough. I think we are also confronted with a lot of disinformation when it comes to origins of these diseases. It's not peculiar to Zimbabwe only. Even during the height of COVID, we're having a lot of theories in respect to some of these emerging diseases. However, in Zimbabwe, we need to still strengthen our health information systems and make sure that they get to the grassroots. So in responding to that question, I still feel that as a country we need to invest a lot in creating health awareness when it comes to MPOX. There is never enough information when we are confronted with such a disaster of that magnitude.
Konapo, Ipapo pa ZTN Prime, DSTV channel 294, the place to be.